I've struggled with this my whole life. Just made me so insecure. It's life-changing. Thank you, Dr. Lebowitz.
Dr. Lebo, Gyno and Beyond, 32-year-old from New Jersey who was exactly 24 hours post-op from bilateral gynecomastia gland removal under local anesthesia. Now, in the past, I stick a sterile tweezer between my interrupted self-absorbing internal stitches, but I'm going to do something a little differently moving forward. Instead of opening with a sterile tweezer, I just take a little needle and syringe. No hurt because he's still numb. Lift up that arm just a tiny bit if you can. There's no really fluid, but I want to make sure there's absolutely no fluid there. So take a little needle right here, just where the water meets the beach by the edge of the, there you go. And I just get in there and just make sure there's no fluid at all. And there's always a little bit of fluid, always a tiny bit. Because I do it on the local, so there's a little bit of fluid. You all right?
Yeah.
Yeah. Little fluid in there. And just take the needle and just very superficial and make sure all the fluid is out, which it is. Open up that armpit just a little bit, my friend. And that is absolutely perfect. Good. That's all we need. Done. It's about a 2 cc and a half out of there. Good. We're done. Come out of there. Same thing where the water meets the beach, a little pinchola. There you go. Boom, right there. And just a little bit of fluid. Easy peasy right there. Always trying something different. Now, if you left this in, the body would absorb it, but could turn into a little bit of scar tissue. Open up that arm just a little bit there, baby. And this is normal stuff. This is great. Great. Perfect. And 1 second. That is perfect. So a little bit of hollowing out is expected at 24 hours for 2 reasons. One, he's still swollen. And the second reason is scar tissue did not form yet. Now I take out the whole gland, pretty much 98% of it, because I never have a recurrence. And while I'm in there also, I contour around with my scissors to make sure that everything is perfect all the way around there, below the nipple, to the sides and above, and really etch that pectoralis major muscle. So over the next couple of months or weeks, this swelling will go down and a little bit of scar tissue will form, as it always does, and he will have perfect, guaranteed results and look amazing. He should eat clean, exercise, lose a little baby fat, which is always the case, and my results will be lifelong perfection. So this is draining post-operatively, a little bit of fluid, which always happens. Lebo, Gyno, and Beyond, 631-424-0101, or email me at jonathanlebowitzmd@gmail.com. Let's go!